How do doctors diagnose an endometrioma in fertility patients? Imagine trying to find a small, hidden treasure inside the body. That's often what diagnosing an endometrioma feels like for fertility doctors. An endometrioma is a type of ovarian cyst filled with tissue similar to the lining of the uterus, caused by endometriosis affecting the ovaries. For women struggling with fertility, identifying this cyst accurately is key to planning the best treatment. The process starts with a detailed medical history. Doctors ask about symptoms like pelvic pain, pain during or after sex, and any history of endometriosis or other reproductive issues. Even if symptoms are mild or absent, fertility concerns alone can prompt further investigation. A physical exam is next, where the doctor gently presses on the pelvis to feel for any irregularities, cysts, or tender spots. But it's important to remember that a normal exam doesn't rule out an endometrioma, especially if the cyst is small. Imaging tests are crucial in diagnosis. The first step is usually a transvaginal ultrasound, which involves inserting a probe into the vagina to get a clear picture of the ovaries. Endometriomas often appear as round, homogeneous cysts with a characteristic, ground-glass appearance on ultrasound. These cysts are usually between 2 and 10 centimeters in size. If the ultrasound suggests an endometrioma, the doctor can confirm the findings and assess the cyst's features. In some cases, especially if the doctor suspects deep endometriosis involving other pelvic organs like the bowel or bladder, magnetic resonance imaging is recommended. MRI provides a more detailed view of the pelvic structures and helps determine the extent of the disease. It's particularly useful when planning surgery or fertility treatments, as it shows the relationship between the cysts and surrounding tissues. While imaging is very helpful, the most definitive diagnosis comes from a procedure called laparoscopy. This is a minimally invasive surgery where a tiny camera is inserted through a small incision in the abdomen. The doctor can directly see the ovaries and other pelvic organs, identify endometriomas, and take tissue samples for biopsy. This confirms the diagnosis and allows the doctor to evaluate the severity of the endometriosis. However, in fertility patients, the decision to perform laparoscopy isn't automatic. If the ultrasound clearly shows an endometrioma and the woman is planning fertility treatments like in vitro fertilization, some doctors may skip surgery to avoid reducing ovarian reserve. Instead, they might relying on imaging and clinical assessment to guide treatment. The overall approach is personalized. For women with mild endometriosis and small cysts, doctors often recommend medical management or proceed directly to fertility treatments. For larger cysts or more advanced disease, surgery might be considered to remove the endometrioma, but only after careful evaluation of the potential benefits and risks. Removing large cysts can sometimes harm ovarian tissue and reduce fertility potential, so the decision is always tailored to each woman's age, ovarian reserve, and fertility goals. In summary, diagnosing an endometrioma in fertility patients involves a combination of thorough history taking, physical examination, ultrasound imaging, and sometimes MRI. Laparoscopy remains the gold standard for confirmation, especially when surgery is planned. It's essential for women to work closely with their healthcare team to determine the best approach based on their individual situation. Always remember, accurate diagnosis is the first step toward effective treatment and achieving your fertility goals. Be sure to consult with a qualified reproductive specialist for personalized advice and care.